Welcome to the Talking HealthTech podcast. My name is Peter Birch. I'm here in the offices of Rauland, Australia, New Zealand, here in Sydney, and I'm joined by Steve Gomes, their Managing Director for the region. Hey, Steve, how are you going?
Good, thanks, Pete.
It's great to be here. Thank you for having me here in the Rauland office. Keen to learn a little bit more about who you are and what you do of Rauland here in Australia, New Zealand, and globally too. But firstly, tell me a little bit about yourself and your experience in digital health and how you've kind of arrived at what you're doing now.
Sure. We started this business about 33 years ago now. And prior to that, I was working in a public company, and they had a health division. So I kind of got into the healthcare side of things then, and always really enjoyed it. When we first started the business, it was quite challenging because the technology adoption in tertiary hospitals was pretty low. So of course that creates opportunity. So we managed to get some good technology and then slowly bring them up to speed with that side of things.
And so here now with Rauland, tell me a little bit more about the role that it plays within the digital health ecosystem or what it does.
Okay, so in the healthcare side of things, I always think about the clinicians first, and because they're the people that are using this technology. In the past, there was a tendency to rely on other people to deliver the tech, engineering, places, IT, and people like that. And but now I think it's really important that we engage with the clinicians nice and early before we deploy solutions. We have a clinical team that we've built up in the business, and we're national, so we've got offices in each of the major cities throughout the country. We also have offices in New Zealand. We have a platform that we've been developing since 2017. It's called the Concentric Care Platform, and we source certain equipment from Germany, US, and other places. And we also have our own engineering team who operate out of the Melbourne office. There's about 25 in the engineering team, including creative team as well, who take care of the user interface side of things. But when developing the platform, where we kicked off with it was to have what we call enterprise thinking. So I'll give you New South Wales as an example. So they've got a fantastic initiative where they're rolling out electronic medical record system to all their hospitals and standardising. It's called SDPR, Single Digital Patient Record. And it's for companies like us, we need to support them in that delivery. So our solutions seamlessly integrate with the electronic medical record system. And the concept of enterprise is to be able to deploy one set of virtual machines, and it can drive all the hospitals basically in the state from that one place. So you're not replicating technology, and from a sustainability perspective, you're not having to have virtual machines and hardware in each of the sites. If you had 150 sites, you can imagine how difficult it is to manage that, whereas it can be managed from one place.
So it sounds like there's a strong presence, obviously, in healthcare, but also understand aged care is a strong focus for you as well?
Yeah, absolutely. So in the hospital market, there are about 550 hospitals that are what we call our target market. And then in residential aged care, we have roughly 2,500 sites around the country. Again, that's a very complex area. There are lots of people that are going through now that are used to using technology, and they want decent technology when they've decided to go into independent living or nursing home or those sorts of places. So we have invested heavily in that side of things. There was a Royal Commission recently into aged care, and there's a lot that came out of it where we are working on developing technology to ensure that those things out of that Royal Commission are captured.
It's interesting thinking about that evolution of the needs of technology and healthcare and how it's come together. As you've kind of alluded to, at one point it's devices that go into healthcare settings that's almost placed upon there, and then the clinicians just use it because it's quite transactional. But as those needs have changed, both from the clinician's perspective, but also the health system and the management and the oversight and the ability for them to engage with each other, it feels like even if you are only creating hardware, there's a need for that user interface, a software element, and the ability for them to all connect. So I guess you've seen that journey with Rauland as well.
Absolutely, yeah, and it took some time to get people on board. So clinicians are very busy people. They don't have time to go and do research. So it's for people like us to go out and do that research for them, come back to them and say, okay, so you've got your processes working this way right now. How about we look at adjusting those processes with some better technology? Then we test. Then we might go to a live site, a live hospital. And you've got different departments, the emergency department, you have ICU, CCU, you'll have the inpatient unit wards, medical, surgical, rehab. Each of them operates very differently, but your platform needs to be able to provide solutions that are agile for each of those departments.
I'm keen to learn a little bit more about that. I guess the what success looks like, or what the outcomes are that you're really looking to kind of drive home, because you've touched on a fair bit of it already, but to think about all the different moving parts that you've alluded to within a healthcare system, sometimes that can be by understanding the big issues to solve, it can feel a bit nebulous or in someone else's court, if you know what I mean. So in terms of where do you really see that if you do your thing well, this will happen, if you know what I mean? Or what are those outcomes that you're looking to achieve?
Yeah, so we always have data to support whatever we're doing. So we will pull data before we deploy a solution that's fixing a problem and show them the before and after. So, and clinicians like to see the data and making sure that what we're doing really works for them and we're not creating work for them.
Yeah.
Well, so if you look at a typical floor of a hospital, an inpatient unit area, we provide all the hardware and software that goes into the patient rooms. So at each bed, you'll have a communication system with full speech capability. And these days, what we're doing is we're adopting what we call a single device strategy. So every nurse would be provided with a smartphone. And also, people that provide environmental services, such as cleaning department, transport, everyone has a phone provided. So what this means is we can run with what we call a quiet environment, where the alerts out of the solutions, even if it's patient monitoring and nurse call, would go directly to the relevant nurse that's looking after that patient. So you have that continuity of care. So quiet environment's really important. And we've been deploying to a number of facilities, and pretty much it's standardized now where everybody wants that capability. You can imagine a patient in a maternity ward where there's an audible tone outside that room. They're trying to get some sleep. It's not real good. So the other thing that a smartphone does for us is when they walk into the room, it can set up the room for escalations. So if there's a problem that needs to be attended to quickly, we know exactly where the call's coming from, and it can set up, for staff presence, and the data can be captured really quickly. We can also present onto their phone who that patient is, whether they're a fall risk, whether they're an infectious risk, those sorts of things. So they have that visibility before going in.
Yeah, it's interesting that, just back to the point around the quiet environment, because with more and more data being collected, there is the capability to provide notifications about anything. But we know alarm fatigue is a thing within the healthcare system. We don't need an everything's okay alarm every couple of seconds, and that's important for clinicians in this space of burnout and how we're looking to do more with less, but also from a patient's perspective in those environments where they're feeling vulnerable. So it sounds like taking in both those perspectives is really important as well, both from the clinician's perspective and the patient's.
Yeah. So from a nurse unit manager's perspective, we can give them visibility over whether a particular nurse has been assigned some difficult patients to look after, and we can spread that load out without, having one nurse looking after 3 patients that are high maintenance. For example, in a medical ward, there's a lot of requests to see a nurse, and what we want to make sure is that you're not tying up one person, they can't do their job very well, and stress and burnout can come as a result of that. So the nurse unit manager can look at a dashboard and determine what sort of activity there is, and also set up the next shift for success.
Yeah.
I
think about these problems to solve that we're talking about and the ways that you can do that. And I guess there's many different ways to address the problem if you're looking at deploying technology within a healthcare system. We can be spoilt for choice sometimes. So in terms of, how Rauland looks at the problem and what it can bring to the table, and there's many different ways, as we said, that you could do it. What's unique about the way that you do that?
Fortunately for us, we've got our own engineering team, which means that if a customer comes to us with a problem that needs to be solved, what we do first is to make sure that the process is right or needs to be adjusted, and we walk them through that. We deal with the technology last. The technologies can do whatever you want it to do, and there's different ways of adopting it. But what we like to do is look at how we address the problem, and whether that's something that can be resolved long term for them. So the agility is there in that we don't have to wait for an offshore corporate large organisation 2 to 3 years to get some software built to solve a particular problem. We do that in-house.
I just think earlier we were talking about, the clinician's needs and the patient requirements and how Rauland does things a little bit differently too. What I like also is in meeting with some of the team, and we've heard on the podcast previously, is, that the focus that you've got on the clinical side. You touched on engineering, but I think it's important also to delve into that and understand a bit more about why you've got that investment in the clinical team and the roles that they play in kind of the process in, implementing technology and then supporting it too.
Yeah, clinical team provides the business with a lot of expertise. For example, we might have a weekly session on, a cardiac arrest. How many types of cardiac arrests are there? And they would guide you through that. So it's great for our engineers and anyone else, operations team, project teams, to hear about how those things come together, because otherwise you wouldn't have access to it. So that's one thing that's really important. The other is that the clinical teams work very closely with anyone that's designing a facility in ensuring that it's set up for success. So they will look at example clinical workflows that have been done elsewhere, what has been really successful, and they'll walk through those things with the client that's about to build this hospital. There's some very sophisticated workflows these days. We have what we call a touchscreen workflow terminal that would be in each of the patient rooms, and in theatre, every theatre would have one. Basically, it avoids having to make a phone call to get a job done. So if you want to, say, have a clinical if you want to have a clean done in this particular room, there's lots of different types of cleans. It could be a quick clean, it could be a discharge clean, it could be a spill. So we can press a button and that automatically sends the alert off to the right person.
But I think that's important to highlight, I guess, the how specific and focused the solutions can be, and by bringing together both those engineering teams to bring the technical capability, but also the clinical requirement, and then having that close engagement with clients in that build can really solve those problems in quite a specific way. I was thinking too, as you were talking, in new builds or in integrations or in how you then work with the rest of the ecosystem. We know that healthcare is a team sport, and that includes the vendor community and all the different stakeholders in healthcare too. Talk to me about how Rauland approaches partnerships and the importance that is in the work you do.
So if you look at a brownfield site, that's an existing facility. I've seen some of those sites have over 1,000 different systems, which is crazy.
Yeah.
So when we have a greenfield site, that's an opportunity to significantly reduce the number of systems there are. And you might have a large EMR deployment, electronic medical record deployment, like an Epic or a Cerner and those vendors, and they would reduce the number of systems that are required for the facility. So sustainability is really important. We need to think about that. So we use our platform to complement those larger systems. So the interface capability or integration capability, we use things like HL7. We look FHIR is another international interoperability integration system. So we use those standard integrations to ensure that our solution can work with any of those that are out there, and you can have that seamless integration. For example, if you've got a smart bed where we're in a patient room, you might want to look at fall prevention or pressure injury reduction, and we get those alerts from the smart bed. We have Bluetooth tags on those beds through our platform, and we can automatically let the nurse know what's happening there. They can, you can send an alert to the nurse. They can talk back to the patient who's trying to get out of bed and they're a fall risk. We don't want them to get out of bed by themselves and hurt themselves. And we can talk to them and say, I'll be there in a minute. So that kind of integration capability is really important.
Yeah.
We also look at things like has the nurse forgotten to arm the bed because that patient's a fall risk, it needs to be armed. So we get those alerts and we can send them a reminder just in case they haven't.
It's interesting hearing about how, the role that or hypothesize on how technology is going to, evolve with the healthcare system. And I think it's clear that the right technology solutions aren't the ones that are going to replace the clinicians or remove the need for clinical input, but by doing some of those examples that you've mentioned, and if we can provide ways to enable clinicians to not have that additional cognitive load or pick up on things that might have been overlooked, or even identify potential future issues, that has huge opportunity to allow clinicians to spend more time and hopefully improve outcomes, but also potentially reduce costs on the healthcare system, right?
Yeah, really important to ensure that registered nurses are doing the work that they should be doing and not anything less, because they're very hard to they're few and far between, really. And we need to make sure that those support staff like PSAs are there to do the jobs that they should be doing. So registered nurses we need to set them up. And that's why we use this single device strategy, so that they're getting the correct alerts, the right alerts to deal with. We have Active Directory integration. So when they come on shift, they simply pick up the phone from the charging rack, and these days it will automatically know who they are and which beds that they're looking after on that shift, very simply, and off they go.
Lastly, then, thinking about as we move into 2025 and look to achieve even more things, and the technology landscape is really interesting right now, and healthcare needs continue to be high priority. Where's your focus now? What can we look forward to seeing from Rauland this year?
Going forward, there's lots of things that we can do. So what I like to look at is process flow and how they can be improved. It's very complicated in health. So you would have heard of the concept of digital twin,
Sure.
whereby you've got the physical being doing the job, and the digital twin is looking at whether the job could be done a better way, and we can get better outcomes. So that's something that's really interesting to us. We're also deploying a lot of different types of technology. 4D radar, for example, which will tell us whether a patient's in bed, whether they're out of bed. And by the way, it doesn't use a camera or anything like that, so there's no issues with privacy. Or, if they've had a fall, and we need to get the nursing staff there very quickly, they'll get an alert to their device and they can get there. So there's lots of technology that we're bringing to the platform. There's electronic meal ordering at the bedside through our concierge bedside terminals. They're a 18-inch screen, touchscreen on a retractable arm at the bedside. And you also bring in things like family and friends. So let's say I'm in the hospital and I want to connect with you. I can do it from a drop-down, touch your name, and you'll get a link to your phone. And you could be anywhere on the golf course or wherever, and you could be talking to me.
Yeah. That's cool.
Yeah.
There's a lot of potential there, and I'm sure there's a few topics there that we could dive into and have a whole other episode on, but we're going to have to leave it there. Steve, I appreciate you making the time and giving that overview. Look forward to speaking again soon. Thank you so much.
Great. Thanks, Pete.